In today's video, we're going to talk about 5 requests that a good doctor wouldn't grant to you as a patient. This is necessary because many times doctors are being requested to assist in such things and they are outrightly wrong. In the course of the video, you know how wrong they are and the implications of these things. And when doctors refuse to grant this request, they're being seen as wicked. So let's dive into today's video. Welcome to my channel once again. Here we make videos that cover all you need to know about medical doctors and medical students. Even if you happen not to be one of us, these are videos that will benefit you too and will be interesting to you. So if you're new to this channel, please subscribe and turn on the bell notification so you don't miss my videos, which I drop twice weekly. And to my returning subscribers, I will keep on appreciating you guys for coming over and over again to watch my videos. The first one is managing a patient over the phone. Management is a blanket statement that refers to how a doctor handles a patient health-wise. It covers the steps you use as a doctor to arrive at a diagnosis, which involves history taking, examination, and investigation. Then you come up with your diagnosis. Also treatment and other things too. So understand that there's a reason why we see you at the hospital. It's because that contact is extremely important. There are many diagnoses that are clinical. That means you must see the doctor and the doctor will take your history and examine you to arrive at the diagnosis. The doctor does not even need an investigation to confirm the diagnosis. However, again, there are some diagnoses that will need these investigations. But irrespective of the kind of diagnosis it is very important that your doctor sees you. Using the phone restricts or denies the doctor of that opportunity, and it's very easy for a doctor to misdiagnose you in this kind of situation. So that means you're putting the doctor in a tight corner when you call the doctor or you text the doctor and complain, and you just suddenly expect the doctor to diagnose you and treat you. Some even go as far as investigating. They go and just do tests. This happens very well in Nigeria, where I come from. I don't know for other places, but a lot of people do that. They just go and run tests and just share the results with you and expect you to make a diagnosis and treat them. These are wrong. Ethically, it's wrong for a doctor to do that. I cannot tell you enough stories of how many doctors had either lost their licenses or had been suspended because of this act. It's actually wrong. So if you happen to be a doctor that is doing that, know that it's wrong. If a patient wants to be seen, insist that the patient comes to the hospital. You're actually not doing the patient a favor by doing that over the phone, because something that might look simple might be way more complicated than you think it is. So at least the patient should come over to be extensively seen and investigated. Then you come up with your diagnosis so that whatever you do, you can properly back it. If you use the phone, you wouldn't be able to do so. So stop that. If you're a doctor and you're treating people over the phone, stop that. You're not a good doctor. And if you are a patient that always asks for that, stop that. Please, that doesn't mean that if there's an emergency and you don't know what to do, you can't call a doctor at least to guide you on what to do at that moment. You can actually do that. Every doctor will pick that. But that shouldn't replace you going to the hospital because you have a doctor that will be able to treat you. Know this, know peace. The second request is you seeing patients outside the official appointed time or time of appointment. It's also a bad practice. There's a reason why every proper hospital has a schedule. There's a time for clinics, there's a time for ward rounds, there's a time for surgery. There are times for different things altogether. So there are some patients that would want you as a doctor to see them outside the appointed time. It's actually wrong. If it's a cold case, it means it can wait. But then if it's an emergency, there's always the accident emergency that will see them. The accident emergency unit runs 24/7. So the person will be seen over there. You indulging in that is encouraging bad practice, because quite a lot of people will now see this and deliberately be dodging the queues or try to boycott the queues during the appointment time. That's the set time to be seen, so that they can just cut in to get favors from doctors. So it's wrong. It's actually wrong. Allow people to do whatever they're expected to do at their proper times. So if a doctor denies to see you or refuses to see you outside the appointed time, he or she is not being wicked. It's actually the expected thing that the person is supposed to do. Some even go as far as maybe they had been seen, but they come along with somebody and ask you to see the person. The person had not booked an appointment and they will just ask you for a favor to do that. Please stop it. Let this person be properly seen and your meeting should be arranged. This is important because sometimes, again, if in case things go south, you're on your own for agreeing to see that person. And please also note that when you agree to see a patient as a doctor, you're also agreeing to be responsible for whatever the outcome of that treatment is too. So if you don't see the person in the ideal environment, then you're putting yourself in trouble. I beg us, let's stop doing that. The next one is patients asking you to prescribe drugs they don't need, sometimes for themselves or for others. Sometimes they make you over-prescribe drugs. Maybe they need a drug for 5 days. They might tell you to prescribe it for 10 days. Or sometimes they make you to prescribe a drug that is not related to their diagnosis. And you can just come up with a diagnosis so that they keep the drugs and the rest. It's wrong. Please, it's very wrong. Stop asking doctors to do that. And if any doctor refuses to do that, he or she is not being wicked. That's the right thing to do. Especially in this very, very trying economy. You might take a drug or you might take drugs you really don't need at the expense of someone else who might need these drugs. So if you ask for drugs that you go and keep at home and somebody really needs it but it's now unavailable, it's very serious and it's really not fair, especially limited drugs. Don't. If you don't need a drug, there's no need to ask for it. As a doctor, if a patient doesn't need a drug, there's no need for you to prescribe these drugs. They are serious offenses. So I beg us, let's stop that. The next one is a very tricky one. Some patients just come because they want to be excused from work or some other things. And they will come up to you to tell you to misdiagnose them or diagnose them with something so that they could get an excuse from work. Please, that's criminal. That's really criminal. Don't. As a medical doctor, don't. Stand your ground. You're not doing that person a favor. So please don't. Everybody should go to work. Everybody should be productive. If you have any reason not to go to work, you can meet your boss to ask for an excuse or whatever it is. But please don't put doctors in situations where they have to lie and it's at the expense of their profession just for you to go through some days of convenience. Thank you. The last one is something that is very serious, but I think only a few people know how serious it is. Doctors know this, but then I don't think patients are really aware of it. And then some doctors might know, but don't know how serious it is. It is, you cannot date your patient. You cannot develop any romantic or sexual relationship with your patient, whether your present or your past patient. Even if there's a situation where you would need to establish that kind of relationship, it's with your past patient, and it must be clearly stated that whatever is happening between the two of you has nothing to do with your previous professional meeting. Because patients meet doctors at a place where they're very vulnerable, and it's easy for you to have feelings for that person, especially when that person has helped you through. So you're not even in the proper state of mind to really process this thing per se. Then secondly is that when there's a romantic relationship or there's an emotional attachment, doctors will not be able to discharge their duties properly. So it's discouraged all across the globe. It's discouraged. It's a very serious offense. So if you tend to fall in love with your doctor, just kill the love. You're not helping his or her career. And they're doctors, you know better, because your punishment will be way more severe. You understand? So no, don't ever agree for your heart to fall in love with any patient, past or present. Thank you. Now, that's all for today's video. What do you think about the video? What did you really like? What did you find out in this video and you were downplaying it before? Let me know in the comment section below. I just decided to do 5. If you have more suggestions, let me know in the comment section so that I'll be able to do another video covering these other topics too. If you've not subscribed, subscribe and turn on the bell notification. Don't forget to like this video and don't forget to share this video. Thank you, and I will see you in my next video.